Welcome back. This is episode 2 of the Momticians. I'm Faith here with Shawna, and what are we talking about today?
Today, we are going over how to set expectations for a family when they're coming in for arrangements conferences.
Mhm.
And then we're also going to speak about waterless embalming in the prep room. So, do you want to start with front of house?
Let's start with waterless.
All right. All right. Well, you know, Faith, there are lots of people that talk about waterless embalming. And it is generally something that they use when there are moisture conditions to be considered, or there is restoration to be done. And the idea is that it limits the amount of moisture in the system,
Hmm.
right? But is that true? That's the idea. But is that true? Is that something that is scientifically supported? And we all know that there are tons of things that go on in the minds of morticians that are not always true. You know, you look at using milk for jaundice.
Right.
Hey, it works because the formaldehyde bonds to the protein in the milk before it actually gets into the system. And so, no, they don't turn green, but they're not embalmed.
Right.
So, what is it about waterless embalming? Where did it come from? What is this monster?
Yeah. And if, I might be embarrassed, I should be embarrassed to say this, but I don't recall learning much about this in mortuary school when I went to school. If anything, it was probably maybe a paragraph in
Mhm.
our book. It wasn't anything we did in our labs. And I have never worked with embalmers that used this
Okay.
on a regular basis. So I myself have honestly done waterless embalming maybe twice in my life, and it was not true waterless. It was waterless, not
Yeah.
no water. It was less water than, the full tank that I think we all just default to. So it's not something that I have utilized much. And I don't know if that's because I wasn't taught it from school or if I wasn't in the right places with people that used it. And so to me, it never became a big deal because I didn't feel it was necessary to do something other than what I was doing that was working fine.
hmm Well, and let's stand back and think about water's role in embalming. I mean, we don't just add it to the tank in order to dilute our formula, although that is part of the deal. Um, Water in embalming is used as a vehicle.
Hmm.
And we think of a vehicle as transportation, which is exactly what we're talking about here.
Hmm.
It allows the formaldehyde to get through everywhere it needs to go. That's the vessels and the capillaries into the tissue before the formaldehyde actually releases,
Hmm.
which is kind of the idea
Hmm.
because we want everything in the tissue, not in the circulatory system.
And this is maybe more of a history question, but these fluids were designed to work with water.
Mhm.
They weren't designed to just be used on their own. And so I just have to wonder, and I don't know the answer to this, maybe you do. When our companies were originally designing these, fluids that are now in mass marketed, I guess, to embalmers only, but still, they were never designed to not be diluted with water or used in it with water as a vehicle. So why then did we not develop it that way if that's a good solution to a problem, you know?
Well, answer to that is that they were developed that way. So the idea of waterless embalming came about by the Dodge Company.
Hmm.
The Dodge Company published a few articles in the Dodge magazine talking about waterless embalming in an attempt to limit the moisture for certain cases and cases with edema or trauma, things like that, in order to get better firming,
Sure.
better results. The issue is think of the co-injections like you would think of lymph.
Mhm.
Now, lymph is its own fluid,
Mhm.
right? But it's also 99% water.
Mhm.
Okay, the rest of it's just little tidbits floating around
Mhm.
in there. And your co-injections are kind of the same
Sure.
thing. It's a giant portion of water with a few added specks here and there
Mhm.
for anticoagulants, surfactants, buffers, all
Right.
that stuff. And so the Dodge company came up with its own formula for waterless embalming.
Mhm.
And because of this, I know of a lot of people that will only use Dodge if they are doing waterless embalming because
Okay.
the other chemicals aren't
Okay.
formulated for waterless
Right.
embalming. The problem is that the benefit doesn't necessarily outweigh the cost
Mhm.
and everything else. Not to mention the fact that these co-injections are designed to work at, a few ounces per gallon.
Right.
So if you have buffer in there, for
Mhm.
example, it is possible to use too much buffer and to
Sure.
throw
Yeah.
pH. It is also possible to have too much surfactant. It is also possible to have too much of any number of things that are in those co-injections, which is entirely possible when you do a waterless solution.
Mhm.
And so people think water, moisture, bad. Okay. But the water that we're using isn't necessarily staying in the body.
Right.
You know, a good portion of that water is coming out in drainage. A good portion of the chemical that we use is coming out in drainage.
Sure.
But we really need to stop thinking about water in our solution as adding moisture
Mhm.
because it really doesn't. Um, a humectant will retain the moisture that's in the body, an emollient will add moisture,
Mhm.
but water in and of itself isn't going to do it.
Right.
Now, do you want to use a 20 index in each gallon of water for a edema case? No, no. But if you use the proper concentration of fluid, you don't need to be concerned
Mhm.
about the water going through the system.
Mhm.
And a true waterless embalming, and I always do the quotes because it's not a true
Well,
one.
there's already water in it.
Right.
Yeah.
So a waterless embalming really, um, I don't want to say that it is a fluid company conspiracy to get you to buy more fluid. However,
It's
there's
marketed differently than what it actually is.
it is
Yeah.
it and the benefits of it don't necessarily outweigh the cost of it.
Right.
Because you look at it, you're looking at about $6 a bottle
Sure.
for your fluid. And if you are using, half a case of co-injection
Yeah.
to level everything out, it's fairly significant, especially if you're one of those companies that has your overhead costs in things like caskets and
Right.
things as opposed to having it in your services. So, maybe they're only charging $550 for
Yeah.
embalming. And, okay, if you spend 100 of that on fluid,
Yeah.
and let's say you paid a trade embalmer 350, well, you just got
Yeah.
$50 to a
Right.
body. And for most funeral homes, that's not worth it.
Yeah.
So while I am never somebody that says, cut corners in the prep room ever,
Yeah.
uh, I don't think that in this case it is cutting corners. I think it's being a little smarter.
Sure.
You know, it's not a better method,
Hmm.
but it is going to cost more money.
Yeah. Yeah. What about the embalmers that will tell you, well, um, if you use a higher index fluid, regardless of how much water you are using in an edematous body, you are going to cause the capillaries to wall off. And so you need to use, specific fluids or whatever it is. I've heard that concern a lot, with this waterless argument.
And let's think of it this way. Using a waterless method isn't increasing the strength of your fluid.
Hmm.
The strength of your
Right.
fluid is determined by how much of that fluid you're using. So if you're still using a 30 index per gallon,
Hmm.
it doesn't matter if you're using water or a co-injection, it's still
Hmm.
the same percentage.
Right.
And if you're using a higher percentage as opposed to using waterless embalming, you really just need to make sure that you've got enough conditioner in there in order to coat the formaldehyde to get it through to where it needs to go. And you've also got water being pulled toward the fluid itself. So even through the process of embalming, you're diluting the fluid by secondary dilution
Hmm.
as it gets into the body if you've got edema or other considerations like that.
Hmm.
So and walling off the capillaries is some people say burning, some people say walling off. Really what it is that the formaldehyde is releasing inside the vessel instead of outside of the vessel.
Hmm.
And as it gets to the capillary and it releases, that capillary is swelling. It's not burning, it's not just creating a wall going, nope.
Yep.
It's swelling up so that you can't get anything through that
Mhm.
capillary. Whereas if you do a pre-injection with a small amount, like a very small index, you can actually get those capillaries in an open position. And there's enough of an index in something like hexaethylenedione. Um, it's got a 7.5, 8 index. There's enough where it'll clear out those capillaries and embalm the capillary open. It'll
Mhm.
hold it open
Uh-huh.
so that as that stronger fluid is going through, you don't have to worry about it because the capillary is already preserved in an open position.
Hmm. Yeah. What about people that would use waterless on a decomp?
It's always a thought, but once again, it's not going to do
What
anything.
are the reasons that an embalmer would think that using waterless would be necessary or more appropriate on a decomp than using traditional?
I think there's an impression that waterless is somehow stronger,
Hmm.
that waterless is somehow giving more oomph to your fluid.
Yeah,
And that's not really the case. I mean,
that's not how math works.
yeah, I mean, you've got more
Yeah,
additives and things like that, but you've
sure.
got no more preservative in there.
Right.
So, in some cases, will it make your chemical work better? I'm sure there's a case here and there where it will, but for the most part, there's really, as far as I'm concerned, there's really no point in it.
Yeah. I would
But,
agree with that, but again, it's not something that I've done hardly at all. So to
well,
think about, I can't think of a reason. In our embalming lab at school, we have many different, staff members that embalm and have embalmed for a very long time, and they have a lot of different methods. And I think it's really cool that the students get to work with this person one day and this person the next day, and see you can get a good result using many different combinations of thing and many different methods. Um, but that's not anything that to me, if I'm in the lab, that I'm ever just going to, I mean, I don't know what it would take for me to go to Waterless. I really don't. So it's interesting to me, like when we see on like the forums online and such, there are people that act like this should be the standard. And
Yeah,
I'm
for
trying to
every
like think
case.
myself through why that would be. And I just can't come up with a reasonable
And
answer to that.
it is entirely possible, just depending on what brand of fluid that they're using.
Hmm.
Um, it's entirely possible that a particular brand of fluid does get better results that
Hmm.
way. I have not run into that brand, but it's entirely possible that one of them does. Um, However, I don't know that combination if it exists.
Yeah.
So, and I'm speaking from my own knowledge here.
Yeah.
But one thing I know that you have done a lot, Faith, is setting the expectations for family.
That is my bread and butter. I
That
have
is
to be
the
honest with you. That is the thing as an instructor that I harp on my students about almost every week in every single scenario, from first call to transfer to setting an arrangement appointment to arrangement to talking about prep to services. I mean the entire process, every single step of the way. I harp on this to them, and I teach them what to say, to manage expectations for what's going to happen next. And I really think that you can be the most knowledgeable, kind, compassionate, wonderful human being and, be a good funeral director in all those ways. But if you don't make it a point in your mind to manage expectations, you're going to come across a lot more problems than you would if you took the time to think that to yourself, every step of the way. And it really can, it's as simple as a couple of sentences. I mean, it isn't anything difficult or time consuming. It's just changing the way that you say certain things, and the way that you present information to families, that it's like helping your future self is what
Mhm.
I tell my students, because if we manage the expectations, then we don't have to come up against improper expectations, and we can really prevent a lot of issues when we take the time to do that.
Well, I was just getting ready to come up. I have this really bad problem using old people sayings,
Oh God.
and I don't necessarily always use them correctly.
Oh, okay.
And that I was almost about to say, there's more than one way to skin a cat, but
What?
in this particular instance, I don't think that's really the best comparison. Um, so give me an example of a way, let's say I have this extremely adenymous case that
Sure.
we're talking about.
Sure.
And, I have a lot that I need to do in the prep room. How are you managing their expectations
Well,
when
the
you're
first thing
working
I'm going to do is I'm going to know what this body looks like and what the condition is before I even open my mouth.
with
So that's a lesson you learn one time. And my
them?
one time, I'll give you a brief anecdote from my life, is I served a family, and they were the loveliest people, truly. They really were. I tear up thinking about them because they were the mother, they were just so kind and sweet. And luckily so for what ended up happening. But the father had died. There was four adult children, a little older than I was at the time. And the wife. And I don't remember what he died of, but he was at the coroner's office, and he wasn't released to the funeral home yet when they were coming in for the arrangement.
Which is
And
great.
for which is not uncommon, and I don't remember the reason, but it doesn't matter. And we met, did, I mean, the whole thing, casket, he was going to be a traditional cremation. And so we were going to have a viewing, have a rosary, the whole thing. And so we got everything ready and planned and all these things. No, I take that back. He was not a traditional cremation. He was a ground burial. And we got him in from the coroner's office, and he was about 500 pounds.
Oh, gracious.
And no one along the way thought to tell this to us, which is not really their fault.
Mhm.
The family didn't bring it up. And again, they likely either assumed that I knew, or it was just who their dad was, and they didn't realize that was something that might make the process different.
Mhm.
And in looking at pictures that they had brought in, the pictures were a little older. He was a large man, but it wasn't anything that, looking at like an obituary picture of like, it wasn't that situation. And so we had to do a different casket, and they had to choose another grave site, because where that grave was that they originally picked, his wife couldn't be next to him because it was too close to something else. So they had to go back and redo a lot of the arrangements that we did because of his size. And that was very embarrassing for me, because that was easily solvable if I had just called the coroner's office,
Mhm.
if I had just looked at the first call closer, you know?
Yeah,
And so it is so important that we know what our decedents look like,
yeah,
what size they are, what condition they're in, and anything else that our embalming, team thinks we should know. And that goes both ways. It is the responsibility of the arranger, in my opinion, to call or go downstairs or wherever that person is. But also, I do think some of that lies on the embalmer, where if they see something, say something.
thing.
That's
Yeah,
it.
yeah.
And so in this case, I before meeting a family, I would call you, the embalmer, and I'd say, "Hey, Shawna, I'm meeting with the family of Mr. Jones. Is there anything I need to know about him? Is he average? Is he normal size? Is he?" And they know what I'm asking. And then you would tell me whatever the situation was. And it could be, oh my gosh, it could be trauma. It could be, I've had care centers send me, photos and things like that. So I could see what they're talking about. So I could better talk about it with the family.
Well, and
Um,
there, I mean,
yeah,
especially right when you send someone out to do the transfer, you should really know a good portion, especially about the
you
weight of
should. You
someone.
should. But
When
that's one of those things that for some reason we lose in communication internally, and I don't know why that is.
yeah,
Especially in larger places where it's whoever takes the first call is not who goes on the transfer, is not who is in the prep room, is likely not who's, if maybe it's an answering service taking a first call or something like that. But it is absolutely vital, no pun intended, that we read that first call entirely, not
hmm,
just look at the name.
okay.
We read it entirely. And if we're the one taking it, that we do a thorough job. And not only that, if we're transfer, I do think, like I said earlier, I think part of it does lie on those folks in the prep room to bring these issues up.
Absolutely.
If the director hasn't asked yet, and the director, you should always physically see if you're in the same building, but if not, call the care center. And in this case, he wasn't in our care yet, but I could have called the coroner, and I didn't.
When my brother passed away, he died in hospice at home. There were stairs to get into the house, no matter what door you took.
Yep,
And nobody asked how big he was. My sister-in-law, it never occurred to her
sure.
to say anything about it. And this is one thing you have to understand with families. Just because it makes sense to you does not mean it's going to ever occur to a family who
To
is
bring it
in
up. Of
shock,
course not. No.
who is in mourning.
Yeah.
And these are traumatic events, and we have to remember that the trauma of these events they're going to affect the way that family thinks. So, something that they may have normally brought up is something that
It's not in their mind.
it's not in the forefront of their mind.
It's not. And, my
When
students, oh, go ahead.
Oh, that's all right. When
Oh,
they sent someone to bring my brother back to the funeral home, they sent one elderly gentleman and a cot. First of all, two people on a house call.
yeah.
Two people on a house call, period.
Two people on a family present, any call, in my opinion.
Yeah, yeah. But,
Yeah,
and
absolutely.
they asked my sister-in-law to help, which, she wasn't terribly comfortable with, but she did.
Sure.
And they tried to use his wheelchair ramp in the back. There was a lift for his wheelchair.
Mm-hmm.
They
Yep.
tried to use it for the cot, but it's a small
Yeah.
square
Yeah.
like lift. So the cot didn't fit on it, and they almost dropped him.
Oh my
They
gosh.
came very, very close. I- I've never been so angry with a funeral home in my life. I'm like,
But that's the thing. You can get into any situation, I believe, almost any situation and normalize it
Mhm.
to the point where the family doesn't realize that you
Oh, sure.
didn't, you could say something like, I mean, gosh, I mean, you could even say, my colleague is on their way. They'll be here shortly. I'm going to step outside and see where they are. Call, send somebody else. You know what I mean? I mean, it's not that
And that's
difficult.
exactly what they should have done. They should
Absolutely.
have stepped out, called someone else,
Hmm.
and, you know, but this is also what happens when you have someone doing the transfer who has not been to mortuary school,
Yeah.
who has not been trained as a mortician. And that's, let's face it, that's 90% of the people that are usually
It
on
is.
transfers
It
are
absolutely is.
the part-time employees that we keep at the funeral home.
Yeah,
And it's important for us, if we are going to have them representing us to the family,
sure. Yeah,
they've got to know what to do in situations like that.
it
Asking the
is.
family to help, that's a big no-no, because they're going, let them volunteer, but don't ever ask them, because then they feel like
I would never
you,
ask
even
them
if they're
for
not
help. Yeah.
comfortable, you know,
No,
but
I would never ask them for help, but I would always let them know that if there was anyone that wanted to, that was
sure,
okay.
sure,
And it's okay to offer that, but that's not the same as asking them to.
right.
But one of the things that my students are terrified to talk to families about is an oversized person. And, I can only speak from my own experience. I'm sure other, industry professionals out there have had negative experiences with this, but in my working life, it's one of two things. The family doesn't realize that it's anything to discuss because it's normal to them.
Mhm.
It's that the person has been that size for forever, and they've lost a little bit of realization, then that does maybe make things different. But when you bring it up, it makes sense to them. Or, they know that that person is extremely large, and additional, things have been necessary their whole life,
Yeah,
or however long, they've been that size. So I've never had a family ever go, "What do you mean my dad's they know. And even if they're not thinking of it in that moment, once you initiate that conversation, they're like, "Oh, they completely get it. They
yeah.
completely get it."
The families, regardless of how upset they are, they understand that you can't control physics.
Right.
They understand that you can't put
Yeah.
uh, you know, something this big in a container this big.
Yeah,
It's not going to work.
sure.
Um, and I do know that there are families that think that, okay, if they're too tall, they break the legs, or, and we don't break anything. We don't, and even I'm not, there are some funeral directors that will like bend the knees a little bit.
I mean, that's why the
And
bed goes down. That's why these things are,
yeah, and I'm not a huge fan of doing that.
yeah.
Get them a proper sized casket, you know,
Mhm.
but
And but managing those expectations again, it depends on your care center. I think it depends on your staff, because I can tell you, I've worked with embalmers where if they called me and said, "Oh, this person's a demonist," I'm not worried about it because they got it. And I know that, and it would take a lot for, some of the funeral homes I've worked at, it would take extreme circumstances for me to be concerned enough about what the outcome might be to have really those difficult kind of conversations with
sure.
families. But I have had to have them after the fact, when somebody, when in a particular case, a young woman, she decomposed at the quickest rate I've ever seen in my life overnight. I kid you not. She went from, coming from the coroner's office to completely unviewable, truly. And I don't say people are unviewable a lot. I really
Right,
think most of
right.
the time they're not. But in this case, it was so extreme, so fast that I had met with the family already. They were expecting a viewing, and now, I mean, it's
You don't ever have to want to make that phone call.
you don't, but it when those phone calls are made, it's important to know what you're talking about. It's important to be able to explain it, at a way that that family can understand. Luckily, her stepfather was a medical doctor. I lucked out a little bit. And so I specifically asked to talk to him. And he
Hmm.
was at the arrangement. He was, completely involved. And so when I called, I asked if I could talk to him, and I did. And I, kind of explained to him, that what had happened and a little bit of why. And I don't remember exactly what I said, but I was talking about, decomposition is a result of proteins in the body breaking down. And there's a lot of reasons for this. And some of the common reasons that it can be accelerated are, if the person is on certain medication, if they died in a certain way. And I know that she had died unexpectedly,
Hmm.
but I didn't know all the details at that point, and we don't always know them and we don't need to. So I assumed, okay, maybe it was drugs, maybe it was, who knows. And he said that makes sense because she died of bulimia. She was found at home and she was a severe bulimic for years. And so when people vomit and when they are not eating right, they already have a lack of protein in their body. So even if they look normal and you prepare them normally, they can still decompose rapidly because they didn't have enough proteins to bind in the first place.
Right.
And so for me, for that family, explaining it in scientific ways and talking about that let them able to understand why what had happened. And they were I mean, I think they were sad about it, but they weren't upset with me. They weren't upset.
Sure.
And I was able to offer them time with her in a room and in her casket, just this or that. And even her hands, I mean, but they were understanding enough about it, and they were just so thankful that they could still do something and spend time with her.
Well, and
But
think about the opposite scenario there,
yeah,
where if you had just called and said, you know, we don't understand why,
yeah,
but she has decomposed
that's
overnight. And I
oh,
mean, that is the point where, the family is like, what happened?
somebody
They're
did something
shocked.
to her. Something is wrong,
And it will come back to
Yeah,
you because
sure.
you are giving them problems without answers.
Hmm.
If you start with the answer, this is why
Yeah.
it can happen,
Yep.
then they can put those pieces together on their own and go, oh, that makes sense because,
Right.
and they can fill in
Yeah.
blanks for
Yeah,
you.
and that's what happened. And I mean, this managing expectations, goes I mean, trauma cases, all of these things. And my students asked me to give an example yesterday of how you would talk about someone that maybe had severe head trauma, and it's very simple in my opinion, because they know how the person died. This isn't a surprise. And you can say something like, in circumstances where, someone passes away in these conditions or under these circumstances, it's very common that they do experience head trauma. Oftentimes that is, maybe the bones in the face have broken, the bones in the cranium have broken.
Mhm.
And while I'm extremely confident in our staff and our ability to make this, a and I'm fumbling now because I'm exhausted, but an experience that you'll be satisfied with. I do want to let you know that despite our very best efforts, there may be some, maybe the way of the positioning of some of the face that may be a little different than you're used to seeing at other funerals. And so that most families are satisfied with that.
Yeah,
If you explain to them, like, maybe we had to do something different than you've seen somewhere else, or maybe it's not going, people that have, severe trauma to one side of the face and not the other, we can do a lot of great things.
for
But
sure.
once in a while, something just isn't exactly how they looked, and
Mhm.
they couldn't tell you exactly why, but maybe it was that they were more swollen than they were used to seeing them, where they don't look bad, but they don't look like they did healthy,
Sure.
before an accident. And so setting those expectations, just letting them know, those things are, i- it's so easy, and it's so meaningful to families. And that goes beyond prep. I mean, it goes into church, it goes into cemetery. One of the things that I tell my students all the time is don't sit down and make an arrangement when you're going to a church before you call the church.
Oh, right.
I would
Because
call
you
the
need to know
church. I
exactly
got to
what
know
that
what
church is.
times are available. What's this? What pastor's going to be there? What's that? I would almost kind of do an arrangement myself before meeting them. So I had everything lined up. And if they say, oh, we want to have a church at Risen Savior, I said, yeah, I saw that on your information, and I called, I talked to Deacon Mark. Next week they can do these times. What do we think about that? And just giving them options that you've already vetted and made sure can really
Right,
happen makes
right.
this process so much smoother. National Cemetery is a huge one too.
Mhm.
If you can call and set up your case before you meet the family, if you know that's where they're going to be buried, you will save them 30 or 40 minutes sitting in the room waiting for you to make that call.
Oh, sure.
All you have to, give them as much information as you have on that first call and call back with the rest later. But
Mhm.
it's so much easier to just call and say, okay, I need to schedule case number, da 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 da. It's a 8-minute call then instead of a 40-minute call because you have to
Yeah.
give all the details. Um, and really kind of painting that picture about what is going to happen those days. And
Mhm.
I find this to be so beneficial, especially in national cemetery cases, because they know they're going to the national cemetery, but they don't realize that it's not like other cemeteries. And they don't realize, okay, you only have this amount of time. This is what's going to happen. So I'm very careful to
Very
really take the
regimented.
time to tell them step by step how that
Mhm.
process is going to go. And it's as easy as saying things like, national cemeteries operate differently than the cemeteries maybe that we're used to. And what's going to happen is, we'll set up the case, all those things. We don't get to choose the time. We have to choose from what's available on a particular day.
Yeah.
And I will even tell families that it is common for families to have a service one day and burial the next because of
Mhm.
because of those times. And that could be, what we come
And if
across
they're
in these
going to
situations.
Arlington, it could be
Oh, it could be
months.
so long. But
Yeah.
but even just the process of, our burial time is 10 a.m. tomorrow. And usually by this time you have a rapport with the family, and unless it's a really, really terrible situation, for the most part, they're relaxed enough to kind of be able to, and I'll say things like, and when they say 10 o'clock, they mean 10 o'clock. They don't mean
Mhm.
10:01. They don't mean 10:02. They mean 10 o'clock. And so we have to make sure that we're on time. We'll be lined up at the staging area because we don't go to the gravesite itself at a national cemetery. All services are held at a committal shelter. And they go, oh yeah, I remember that from whoever serviced last year or whatever. And you just explain to them literally step by step. Once we pull up to the committal shelter, the pallbearers will come back. We'll take the casket to the front of the shelter, at which time whatever pastor, whomever will perform their committal service. The Army, Navy, whatever it is, will perform their military honors. And at that time, it will be time to say our final goodbyes and leave the cemetery. And so preparing them that they're not going to have a lot of time, that once those honors are over, we're talking minutes because we got to go. But I would always say because another family's waiting.
Yeah.
And I feel like people in that time forget that other people have lost people too,
Yeah.
but they're very compassionate about it. And when you say that, they go, okay, yeah, there's another family that's going through this, and now it's their turn, and they're okay with that.
And,
Uh,
one of the things that I would do is, you know, and you and I both know this, when we're doing arrangements conferences, telling a family something is one thing.
mhm.
Writing it down for them is
Oh yeah.
another. And so I would usually have kind of a checklist
So
written
would
out
I.
for them
Hmm.
before the arrangements conference even
Same.
happened. And then I would add to it as I needed to
Add
during
to
the
it.
arrangements conference. But
Mhm.
when it comes to national cemeteries, I would always recommend, please go to the website ahead of
Oh.
time. Take a look at it. I've told you about some of the things to expect. The website will help clear up some of those other questions that you might have.
Mhm.
please go through it, please read it. And most families will.
Yeah, at
Most
least somebody
families
will. At least
will.
somebody will, sure. But and then, yesterday was Veterans Day in funeral directing class. We learned all the veterans stuff. And that is a situation where managing expectations is crucial
I was like,
because
yesterday was not veterans.
no, it was in class Veterans Day. But managing those expectations is crucial because I guarantee you almost every family without fail is coming in with different expectations about what they get or don't get or whatever because their loved one was a veteran than what the truth actually is. And
Right.
so, even in your if you're leaving a folder with a family at a transfer, information about veterans.
Yeah.
You know what I mean? Links to the website so that if they choose to, and oftentimes they will, they
Mhm.
can start looking and they go, oh, really? This really isn't what I thought it was. And
And
then
and
while we're
honestly,
unfortunately often the person has to break the news that no, their funeral is not free because they were a veteran,
right.
we've given them information ahead of time to kind of, at least prepare them a little bit for, what those benefits are and aren't. And that's a great resource to have on your website. A lot of funeral homes will type up some of these things, put the
Absolutely.
links, sem.va.gov, va.gov/burials/memorials. That's your lifeline.
Yeah.
Absolutely. That information exists. Yes, it's hard to read. It's hard to understand what exactly they're saying for eligibility, but it is out there and it's perfectly okay to not know everything as a funeral director too. And that's part of managing expectations.
And they also have to understand that unless they can find that DD 214,
Mhm.
you can't do anything at all.
You
And the
can't.
only thing that a DD 214, if it's an honorable discharge, the only thing it guarantees you is a flag.
Yep.
That's
Oh,
it,
yeah.
and
Oh, yeah. But
in
here's,
a lot of
yeah,
cases you can get a marker, in a lot of cases you can get,
sure.
other benefits, but the only thing that you're really guaranteed with an honorable discharge is a
Yeah.
flag.
They're doing construction here and somebody about came through the ceiling, it sounded like.
Just
Jeez.
what you were doing, you're like, "Oh."
No, but that's yeah, that's so important. That's a whole nother episode to talk about all
It
the
is.
veteran things.
We
That's a
should we
good
should do
one.
a veterans
We
episode.
really should. That is information that I'm passionate about, at least making sure is out there for people, because they're always wrong. They
Yeah.
always are wrong, and it's so confusing. You know that if you're a veteran family, you already know what it's like to deal with the VA. This isn't news, but still, it's good information. Um, Oh my gosh, I was going to say something else. You brought up something that made me think about what was it? Oh, honors. That's another place you got to manage expectations, and especially depending on where you live. I was explaining to my students because of where we're located and the bases that are near us, we usually are fine with Air Force and fine with Army. If
Mhm.
it's other things, it's more likely that they won't be able to get a team or
Yep.
that or if you're a burial at 2 o'clock 3 o'clock, that team has to go all over town, and if they've hit traffic, if a service before was running long, if whatever could happen, they could be late or not show up at all. So when we are requesting honors, it is a request.
Yes.
That's it. And
Yes.
we have to be clear with families on that because we're not ordering them, even though we
I
say
made that
that.
mistake exactly once.
Yep, exactly
Where
once.
I called and I said I'm
Oh,
ordering military honors, and they're like, "You don't order anything." And I'm like,
yep,
Yeah,
yep.
okay, sorry."
Yeah, but
Yes.
even that is something to explain.
Yeah.
We will request these honors. These are the honors that we would expect you to receive, whatever it is. We will request them from the branch. I want you to be aware, however, that this is just a request.
Mhm.
And oftentimes we don't know until we're there whether or not they're going to be able to supply that team and let them know what'll happen if they're not there. So in our area, I would suggest, there are this VFW grant, group, all that's whatever, that can provide supplemental honors to a veteran. And by having them at the service, if the military does show up, then they can do their supplemental, ceremony afterwards. But if they don't, then they're there and can provide them as
Absolutely.
veterans themselves. If not, myself and my staff are prepared to professionally fold the flag,
Yeah.
and all those things. So I
You
manage that
can talk with
expectation.
VFW and get,
Yeah.
some individuals who have served.
But I think it's so important to make them understand that it's a request.
Yeah.
And if it doesn't, if that branch doesn't show up, these things will still happen. They may look differently. It may be the VFW, or it may be the funeral directors folding and presenting the flag, and
Yeah.
but regardless, that flag will be folded at the graveside and presented to the next of kin is what's important. So that
Yeah.
when they pull up, they're not like, oh, I don't see the Navy. Oh my God, oh my God. It's oh, okay, well, here's what's gonna happen instead. Yeah.
Well, I think that our next episode is probably going to have to
Yes, it
be a
is.
veterans
I think
episode,
it
which means
is.
I'm going to have to read some more because, you know, even
VA.gov.
even though I just came from Fayetteville, right
Yeah,
next to Fort Bragg, it's
it's different.
still, there are so many ins and outs to all of it.
So many, so
So,
many.
yeah, let's talk about
Let's do
military
that.
next. All right.
Well, I think that's all for today.
It
I
is.
I have to go to another meeting, but that's just
It's all
how it
right, Faith.
goes
You're making
sometimes.
good choices.
Yeah, that's right. I am making good choices. But continue to make good choices, listeners and viewers. If you have questions, send them our way. I guess we've decided our next episode is on veterans benefits, how to work with veterans families, which were honestly some of my favorite families to work with. Um, and kind of some tips and tricks on things that are absolutely necessary to know, and things that we want to kind of have in our arsenal, so to speak, as resources for ourselves and for families. Because I said it briefly, but we can't know and remember everything.
No,
But if we know where to find the information, then
just
then
as
we'll be
good.
fine, just as good. So see you next time.
Bye.
Bye.